A very interesting question. 45-year-old male chronic cigarette smoker gives up smoking. So his risk of heart disease will A. become same as that of non-smoker. B. drop down slightly and become same as non-smoker in 1 year, or remain the same, drop down substantially in 1 year. What is the correct answer? The correct answer is when a long-term smoker quits, the risk of heart disease decreases substantially within a relatively short period of time. It does not instantly match the risk level of a non-smoker, but the reduction is definitely significant. Specifically, within 1 year of quitting, the risk of heart disease is about only half that of a non-smoker in 1 year. So if he continues to smoke, he would have got 1. Instead, because he discontinued in 1 year, the risk has reduced by half. Over time, this risk continues to decline, and after about 15 years, the risk is nearly same as that of a non-smoker. So the risk is same as that of a non-smoker after 15 years. So you can see that earlier the person quits the smoking in life, it's the better, because he needs 15 times for complete cure. Earlier he quits smoking, greater will be the reduction of risk of heart disease and other health complications. So the correct answer for this question is the risk of heart disease drop down substantially in 1 year. D is the correct answer. Remain the same cannot come because it takes about. Okay, thank you.